is the first patient. At some point, he had a study, and you can see he has this pretty irregular-looking. Actually, I can't remember if it was a he, regardless. Pretty irregular-looking aneurysm. So about 6 months after this, he came into the emergency room with abdominal pain, and you can see that the aneurysm sac has increased quite a bit, became more irregular, and now you see kind of contrast pouring out from where it's supposed to go. And as you go down on the axials, you notice that the contrast is also pacifying the venous structures. So that is unusual, to say the least. CTA. So then when we look at the delays, you can see that even more contrast is going into the IVC, both up and down. And really the coronal images tell the story the best. You can see this is the aneurysm, right? You can see the sacral outpouching. You can see the contrast pouring out from the aneurysm lumen and the connection that you can see between the aneurysm and the IVC. So this is
Victoria, was there any thought that this could be a mycotic aneurysm?
I don't remember. I think he just came in with abdominal pain and hypertension. This is actually not related to, believe it or not, to infection for whatever reason. This is aorto-caval fistula, and it's just a complication of ruptured AAA, where the rupture erodes into the IVC. It's not common, and it has very high mortality rate, but up to 50% for patients who do get to be operated. But it seems that the delay in diagnosis is what contributes to high mortality. So that is here on the MIP. You can see also the connection between the aorta and the cava. So this patient, unfortunately, did not make it because it was ruptured aneurysm.
A question came in. That's a crazy case. Steve says, "Wow," and Khalid asked if there's any contrast in the GI tract. Was
there any contrast in GI tract? I don't. This was a CTA, so no, I don't believe so.
Okay. So I guess he was, maybe if he saw a fleck of it, he was thinking maybe that they had it also possibly eroded into the duodenum or one of those small bowel loops, like aorta enter.
I have seen aorta duodenal fistula once in my life, and as a fourth-year resident. And then at that point, my attending said, "You will never see this again in your life." And so far, she's been right.
I had a case like this that was a mycotic aneurysm. So when you have like a really big saccular eccentric portion, that's something to think about. It doesn't. This one, like you said, it doesn't have a lot of inflammation around it. But right. in the case that I had, I think I showed it on Case Conference. They ended up stenting the aorta. And because the sac around it was still infected, we actually put a drain into the sac, and that's one of the new treatments for mycotic aneurysms.
Right. But this is specifically like a complication of a ruptured AAA that just kind of goes, instead of just free rupture, it goes into the IVC. Cool. Okay.